Behaviors. Some good, some are bad. But for now, let's focus on the bad ones. They don't necessarily have to be bad, but something you want to change within yourself. I, for one, am struggling with reining in my addiction to soda and fast food. We all have behaviors we want to fix, but why are some harder to change than others? Well, this is because there are different classifications of behavior, and depending on which one yours falls under, the methods to change said behavior differ greatly. To put things simply, there are the ABCs of behaviors. A stands for automatic. The namesake reigns true. These behaviors occur without much thought and require a lot of conscious effort to change. B stands for burning. Burning means that there is some awareness about this behavior not being good for you, but you can't help but do it. I certainly understand that. Finally, C stands for common. In this case, you are fully conscious of what you're doing, and you know you should stop, but the process to start is just the main roadblock. Regardless of what kind of behavior you're trying to change, it's still going to be hard, but there are ways to go about this process and stay motivated.
Hey everyone, so today I'll be discussing the relationship of informational technology on patient engagement and behavior change. So the growing sector of informational health technology has enabled us to provide higher quality care through secure computerized systems that specifically focus on individual health needs. But with the luxury of having these systems, I think is when we then also face obstacles such as patient adherence. So when creating these systems, I think we need the input of different sectors. So computer scientists, of course, but also medical professionals, public health officials, psychologists, just to see how we can build something of meaning and usefulness, not only for the patient, but for the doctor and caregivers as well. So also when building them, I think we can also focus on things such as the 8 principles of patient-centered care that basically include things such as medical resources, access to care, wellness and disease prevention. Because to have long-standing patient adherence, we need to know how the new system will develop behavior change, satisfaction, and health outcomes. So psychologists, for example, say to improve behavior change, we need to reinforce one's confidence by self-affirmation, because an individual can only change if they choose to change. So instead of losing sleep and dwelling over our failures, we need to focus on acknowledging those accomplishments which we have already made. So a system that will teach our patients that the changes they are making are in fact making a positive impact on their life, because digital health technology can only do so much, but it can also, however, initiate that desire of healthy behavior change by providing feedback on external factors contributing to their overall health that can later on not only improve their treatment of care, but also improve their overall quality of life.
Noreen and Judit talk about behavior and Heanth IT influence on the patient behavior. I would like to talk about Professor Khine's research, which is an inexpensive and disposable sensor influence on the patient behavior and health informatics. Until now, the breath monitor is still based on the complex manipulation machines, and the machine is very heavy, so the equipment is a problem to make online and easy diagnosis. But now the sensor solved the problem. How does the sensor solve the problem? First, it's easy to use. Just need to chip one put on the lung area and another one put on the abdomen area. Second, a chip is disposable. Third, is able to update data to the cloud power via the Bluetooth devices. So it will change the patient behavior because it saves the time to make the diagnosis, and it provides an option to diagnose at home. Moreover, I have think about that could be able to apply on the other area like the sport breath tracking and real-time vital sign checking. I believe the technique will make a revolution on the medical device area and also on the health informatics area.
I think the idea of using a children's toy to help better the monitoring of breaths is incredible. While listening to Professor Khine speak during lecture, she mentions that one of the ways a patient breathes gets monitored is by looking at their stomach and seeing how many times they breathe in 1 minute. The fact that this method is being used in 2019 is truly shocking, given the technology seen present day. So seeing a device being created to help monitor breathing is incredible, especially since this will hopefully help patients with asthma problems catch symptoms quicker and treat it faster. Although the Shrinky Dink monitor, which is the creation that Professor Khine was part of, is a step forward in the right direction, it is still being used on healthy patients. To see the full effect of the monitor, it will need to focus on testing patients with minor breathing or asthma problems. This small advancement of the breathing monitor can mean a huge breakthrough in the medical field.